Dynamic Digital Displays introduces the Voxelscope, a full-function visualization workstation designed to assist physicians in making faster, more accurate diagnoses through three-dimensional imaging. Voxelscope enables the physician to generate 3D images in real time without the lengthy, time-consuming pre-processing required by batch mode systems. With the Voxelscope, new images can be created instantaneously, and a patient study can be completed from start to finish in less than 10 minutes. Whereas other systems can require anywhere from 30 minutes to several hours of computation before the first image is displayed, the Voxelscope generates images instantaneously once data sets are loaded. For the physician, this means that throughput, interactivity, ease of use, and cost-effectiveness are significantly improved. The key to this unprecedented speed lies deep within the Voxelscope's architecture, the Voxel processor. Developed and patented by Dynamic Digital Displays, the Voxel processor contains a large online 3D memory, which is capable of holding an entire data set accessible for the immediate creation of any image on command. Voxelscope provides full-function 2D imaging, interactive 3D reconstruction, instantaneous multiplanar reformatting, cine presentation, and multimodality display. In short, 3D imaging is now, finally, a practical, valuable, and cost-effective diagnostic tool. But to see exactly how beneficial the Voxelscope will be to your practice, it's best to see it in use on clinical case studies. This videotape presentation of case studies was filmed in real time as each case was reviewed and processed. Our first study is a 38-slice CT dataset of a 45-year-old male with lumbar spine pain. A user-friendly menu allows rapid selection of each case. After a data transfer time of only 41 seconds for this particular study, images are ready for instant reconstruction and 3D display. From this point forward, there is no waiting for pre-processing. The multiplanar reformatting, or MPR mode, displays an image in the main window. With axial, sagittal, and coronal views shown in sub-windows. By rolling the trackball, you can move through reformatted images, while annotations in the sub-windows show the exact position of each new image in orthogonal planes. By pressing one button, you can switch images from axial to coronal and from coronal to sagittal. In this case, the sagittal view reveals an osteophyte at the L3-4 level, causing impingement, the source of the patient's pain. Let's now create 3D reconstructed images. Using a 3D box, a volume of interest may be set to remove unwanted tissues or artifacts, or to specify that part of the image containing the pathology. A cine mode allows rapid viewing to assure proper positioning of the box relative to the anatomy. A predefined threshold can also be selected, bone in this case. Then, by pushing just one button, 3D images are instantly created. Here we can see the osteophyte quite clearly in the lateral view. This image may now be manipulated at will, and additional images can be created with no pre-processing whatsoever. For example, you can easily zoom in on the image, or the 3D image can be displayed in base, AP, or lateral views. Rotated by the trackball, or flipped 180 degrees for easier viewing. You can even slice through the imaged object for better visualization of the osteophyte. And of course, any image may be saved for future reference or transferred to hard copy. Our next study will demonstrate even more of the Voxelscope's powerful features. This particular study is a 38-slice CT dataset of a multiple fracture of the left hip joint. Loading time for this case was 28 seconds. through the slices provides a rapid overview of the case prior to detailed evaluation. Coronal images are especially helpful in this study for comparing normal right and abnormal left anatomy. The window and level can be adjusted to provide the full range of contrast as available on a CT scanner. A volume of interest is specified, isolating the left hip. A threshold is then set, and 3D images are created. Interactive manipulation of images is available in each sub-window. These new images can then be transferred to the main window for easier viewing. You'll notice that fractures of the symphysis pubis, acetabulum, and wing of the ilium are clearly visible. Our last study demonstrates the benefits of the Voxelscope in reconstructive surgical applications. This gunshot victim suffered multiple orbit and facial fractures. Displaced bone fragments are clearly visible in the axial images. Reference to the sagittal and coronal planes is of assistance to radiologists and surgeons in the evaluation of difficult cases. Subsequent 3D images will complete the analysis, assisting the physician in planning a preoperative approach and a postoperative follow-up. The image is easily rotated in the sub-window, then transferred to the main window for high-resolution viewing. Clearly, the Voxelscope represents an important breakthrough in diagnostic imaging. The advanced architecture of the Workstation eliminates the need for lengthy pre-processing. This enables you to create 3D images instantaneously and allows you to complete a patient study in less than 10 minutes. Dynamic Digital Displays is developing additional Voxelscope application software for MR, Cine-CT, radiation therapy planning, and PET imaging. Dynamic Digital Displays, through its technological leadership with the Voxelscope, has finally made 3D imaging practical.